Hey everybody, this is Bethany, and today I'm going to be sharing my presentation called Sales, an Adventure in Dental Hygiene. The learning objectives for this presentation are I want you to be able to explain why sales is an option for the RDH, know what is required for this profession, understand what the job description is in sales, describe the duties and responsibilities from day to day, recognize who is hiring in sales, identify the pros and cons of this profession, and be familiar with salary potential. I just want to take a moment to give a brief introduction on this profession. Sales is an exciting career adventure available to the dental hygienist. While many clinicians believe that patient care is the only way to utilize their dental hygiene training and education, these skills are also very valuable in the corporate world. Hygienists are leading the way as influencers in retail, pharmaceutics, and healthcare services. So you may be asking yourself, why sales? Hygienists actually have a very unique combination of skills and scope of influence that make them perfect for this profession. To start off as their skill set, we're natural educators. We spend 8 or sometimes 9 hours a day educating our patients all day long on their oral and overall health. And so it's very easy to use these same skills to teach offices and providers about specific products or services. We're also professional conversationalists. We just have a knack for being able to connect with people and establish a trusting relationship relatively quickly. We're also highly educated in the areas of communication, oral health, systemic health, and we have a lot of knowledge when it comes to dental products and services. As far as our level of influence goes, most hygienists that have been practicing for a number of years have a pretty broad professional network. We tend to know a lot of colleagues. We also tend to know our reps that we work with from day to day to get our products. We have the ability to generate a following. And we also have the career experience that enables us to relate to other providers if we're talking to them about specific products. We're respected as fellow dental professionals, and we are considered leading experts in the areas of patient care, disease prevention, overcoming career obstacles, and swing decision making. So, what is required in order to have a profession in sales? There are a few that most companies do consider to be essential. Having RDH credentials or a license is pretty important to most companies. They want to know that you have the clinical experience that is required in order for you to have that relatability to the people that you're teaching about certain products or services. They also prefer for you to have a minimum of a bachelor's degree or higher, just depending on the profession that you're applying for. Sales experience is also another really important skill to have under your belt. And I think that a lot of hygienists, they quickly diminish their own sales experience when in reality, working every day with patients, we have a lot of experience in this area. You may not feel like you are necessarily selling anything to your patients, but we're selling health to them from day to day. So we're very experienced in this area. And they're also looking for certain personal skills. The most important ones that come to mind are persuasion, communication, confidence, and customer service. As far as the job description goes, there are three main areas that a person in sales focuses on. As far as practice education goes, they're in charge of teaching dental offices about new products and services to increase profitability and promote improved patient care. This is usually done through lunch and learns, webinars, and sometimes through business assessments, just depending on the type of service that's being offered. They also assist in the ordering process and provide customer support to the practice. They do a lot of networking as well. They're present at most continuing education events like trade shows and conferences and large meetings. They connect with other professionals, colleagues in the sales rep world, dental professionals, and industry leaders. And they also do a lot of mentoring. And this is a relationship that can benefit both parties, the person that's providing the mentorship and the person that's receiving it. They teach by experience. This can open a lot of doors for either person. And they offer a lot of encouragement and inspiration for the clinician. They allow them to stay up to date with products and practices. As far as the duties and responsibilities go of a person working in sales, they're considered the product expert. So they really need to know all the nitty details, the ins and outs of the product or the service that they're educating their client about. They recruit potential customers, they educate about the product or service as far as its indications, the benefits and risks. They demonstrate how to use the product. They answer questions. They also prepare and negotiate sales agreements. They train the office in proper use. They provide information on the most recent advancements in patient care and technology. They follow up with the offices after the presentation. They do work to meet specific sales goals, and typically, most sales individuals will travel to different events and meetings. Who is hiring? There's a lot. I actually just picked a small number of some of the more well-known companies that tend to hire hygienists as sales representatives, but there's many, many more than this. But you're typically looking at dental supply companies, major manufacturers that specialize in dental equipment, tools and technologies, and dental laboratories. So, the good and the bad of sales. There are definite pros and cons in this profession. As far as pros, sales gives you an alternative to clinical hygiene. It also provides a variety in work environment. You're able to follow advancing trends in science and stay on top of those things as they develop. And sales also gives you an opportunity to travel and experience new places. As far as the cons go, there is a lack of patient interaction. So, if providing care to your patients really gives you life, sales may not be the best profession for you. There's also a pressure to meet quotas, and the application selection for these positions are largely based on who you know. There also have been some challenges related to COVID-19. It's been difficult for a lot of sales professionals to enter practices to be able to teach them about products just because of a lot of safety protocols. So that's definitely required these professionals to get more creative with how they can interact with these businesses. As far as salary potential goes, there's a lot of fluctuation there. It really depends on the specific company that you're working for and the workload that you have. But according to the Occupational Outlook Handbook, median pay for sales rep last year was $65,420 per year, which averages to about $31.45 cents per hour. There are bonuses typically associated with these positions that can range anywhere from $1,000 to $45,000 per year. And there also tends to be some sort of commission package or program associated with the sales position, and that can average anywhere from $3,000 to $11,000. In summary, out of the multiple career options available to the RDH, sales is a fast paced, ever changing field that offers unique variety and endless opportunity. Dental hygienists are appropriately prepared for a successful, fulfilling experience in the corporate setting and the adventure is waiting for those who dare to take the leap. Thank y'all for listening to my presentation. I look forward to your feedback, and we'll talk soon.